So much for joining us today on this beautiful Thursday morning. At least it's been beautiful here. The weather is definitely in mid-Missouri where we're at is starting to transition into spring a little bit. So we're getting some of that rainy weather, but no more snowstorms or anything like that, knock on wood. But this beautiful Thursday morning, my name is Sadie Palmer. I am the Strategic Communications Lead here at Senior Marketing Specialist. And today I get to just play a host role for our partners over at Allstate. Today, we are going to be chit-chatting about ACA alternatives and also some ancillary products. Two very hot topics right now. And then, of course, Senior Marketing Specialist loves to talk about ancillary products and ancillary sales. So we're excited for what we have in store today. Of course, I'm not the star of the show here today. We have Caden Bradbury. He is the Field Vice President for Allstate. Allstate, even though with a new name, this company has been a longtime partner of ours, and we've loved working with them. So we're excited to have you guys on here today. Before we get started, I have a few housekeeping items, and then I'll hush. This will be recorded, so if you have to hop off, that's okay. We'll be having this, posting this on our YouTube page. We'll also have a follow-up email after this where the recording will go out. And then please feel free to use the chat box. We will save all of the questions for the very end just to make it a little bit easier, but please use the chat box, throw your questions in there. It makes our job a lot more fun, makes it a lot more enjoyable for you, and you get more out of it. So please feel free to ask questions, comments, concerns, whatever you want, throw it in there. Just I can see them. And let's see, yes, you'll have a follow-up email that goes out after this. But I believe that's all I have. So Caden, I will go ahead and let you take over.
Appreciate the intro, Sadie, and teeing me up nicely there. And thanks to everyone for joining today. I know all the time you spend on webinars is time you could be selling policies. So I'm going to try to make it worth your time today. 2026 looks a lot different than the last couple years did for the under 65 individual health insurance space. So excited to dive in here, exactly what changed, how this disruption affects you, and what you can do to essentially win and have success in 2026. I'm up here in the top left if we haven't met before. Like Sadie said, I'm the Field Vice President over here at Allstate Health Solutions. I know you have a fantastic support over here at Senior Market Specialists, but if you have any Allstate specific questions or need help with a quote that got stuck, product information, anything like that, feel free to reach out to myself or anyone on my team. In fact, Sherry knows the products much better than I do, and is probably even easier to get a hold of than I am, as I'm on the road quite a bit. So she can be a great resource for you for product info after this. We're going to be doing a high-level overview today as we have the time constraint. But if you want to do a deep dive or want more specialized instruction or training, feel free to reach out to us. You can even scan Sherry's QR code there and book a one-on-one training session with her via Zoom or Teams. If you have any other questions, feel free to reach out to any of us, and we will definitely point you in the right direction. So open enrollment's over, and a lot of times agents have a hard time figuring out, what do I do now? Open enrollment's just such a chaotic time of year. It's hard to snap out of that right after. So it takes some time to put together a plan and figure out what your new day-to-day looks like. Like I mentioned, there's been a lot of disruption, particularly in the ACA market, a lot of movement that's already taken place, and a lot of movement that's going to take place that you should be prepared for. The big two opportunities this year are marketplace alternatives. So we'll be talking about our short-term medical plan and previewing a brand new plan that we'll be releasing in a couple months here. And then also cross-selling. So the reason why these two things are important, let's get down to the why, is the ACA marketplace, essentially three big changes happened. The first one was there were big subsidies that were passed during COVID to assist people with purchasing health insurance. Those were set to expire end of 2025. There were some talks into 2025 to potentially extend that or renew those subsidies. That did not happen. So essentially we go back to 2020 and previous where there's a 400% poverty level cliff. What that means is if an individual makes about 60 grand or more, couple makes about 81,000 or more, or family four makes about 125,000 or more, you get $0 of subsidy, $0 tax credit. So your health insurance is significantly more expensive. Another thing that happened here, besides a lot of people losing subsidies, was massive rate increases, historic, bigger than we've seen in the last 8 or 10 years. On average, it's about 23% rate increase there. But we saw anything from 15 all the way up to 30, really. But losing subsidy and then taking a rate increase on top of it was really a bad double whammy. And then if that wasn't enough, individual max out of pockets went from $9,200 to $10,600. And if you've seen it in the news already or haven't, individual max out of pockets are going to $12,000 in 2027. So we're already 10 months out from that hitting. Pretty crazy. We're already a couple months past the new year. But what this does is a couple things. When prices go up in marketplace, the need for alternative plans increases ever more. The reason being is these alternatives I'm going to talk about, they usually cost about half as much as a bronze plan with no subsidy. So instead of paying $1,000, you're paying $500. Instead of paying $2,000, you're paying $1,000. So you can save people thousands of dollars if they are a right fit for one of these alternatives, and we'll talk about who the right client is as well. And then another thing is with the price going up, a lot of people are taking plans that have bigger deductibles or bigger max out-of-pocket exposure. And with that comes a bigger need for supplemental insurance, especially next year when individual max out-of-pocket goes to 12,000. You're going to need to be an expert at cross-selling supplemental insurance, or your clients are frequently going to be very unhappy with a massive out-of-pocket exposure that they'll have to come up with not so great means to cover. So this is probably how you felt a little bit preparing for 2025. In 2025, I need to update it and say 2026 because we're still going through it. But there's a lot of chaos, needless to say. I've talked to a lot of agents and they say it was the most chaotic open enrollment period in their entire careers. These are 10-year, 20-year, 30-year vets. It is chaotic, no doubt. I know you guys had more hard phone calls this open enrollment period than you've ever seen before, but I don't want that to take away from the massive opportunity you have this year as well to keep your clients on affordable solutions, give them better protection, and also make significantly more money, as alternatives typically pay 3 or 4 times as much commission as a marketplace plan, despite being more affordable for your client. So let's dive in here. Short-term medical, give you the rundown. It's been a back and forth battle for the last couple of years. So you might have heard short term's only 4 months, and then short term's only 1 year, and then short term's 3 years. I don't want to get into the nitty gritty of it all, but just know short-term medical is back on 3-year plans in most states. Particularly Missouri has a 3-year plan. I know a lot of you are based out of Missouri, but short-term medical is back and it's here to stay. So you don't need to worry about the 3-month or 4-month restriction any longer. As far as state availability goes, pretty much everywhere in blue or pink, you're looking real good. Texas did come back after all these regulations, and they're still stuck on a 4-month plan. But we anticipate them going back to 3 years soon, as soon as this summer. Right now we do have a unique solution there. So if you're selling in Texas, please reach out to me. We've got a 3x4 that'll get your clients a year solution. But Missouri, surrounding states, you're all pretty good there with 2 or 3 year plans. So now that we've talked a little bit about where it's available and why, who is the customer? Because short-term medical and alternatives, they make a ton of sense when it's the right fit, and they make no sense when it's not the right fit. So we need to make sure we're looking at the right type of client here. For starters, it's people who don't want to pay high ACA costs. They're not getting subsidies, and now their price went way up, or they're just getting a little bit of subsidy. Like I said earlier, short-term medical is typically about half the cost of a no subsidy bronze plan. If you miss open enrollment period, you have year-round open enrollment period, next day effective dates with short-term medical. So you don't have to wait until November 1st to enroll in this plan or qualify for a special enrollment period, just next day effective dates year-round. Between jobs makes sense, early retirees, bridging the gap till Medicare, those turning 65 individuals. And then we talked a little bit about this, but how it benefits you is when you save thousands of dollars in premium for your clients, there's a lot more room in that premium to cross-sell, sell those supplementals. You earn a ton more while being a better agent by offering affordable solutions to your client, saving them thousands of dollars and better protecting them as well. Now, like I said, we do want to make sure we get the right client in here. So the difference between short-term and marketplace is essentially underwritten financially. So how much money you make determines how much money you pay for insurance. With short-term medical, that's not the situation here. Instead, it's medically underwritten. So you do have to pass some health questions. It's pretty brief, and I'll show you that list of what the questions look like here in a few slides. But your clients do need to be relatively healthy to even qualify for the short-term medical. That means no diabetes, no cancer, no heart attacks in the last 5 years, things like that. We already talked about this, but it's available year-round, open enrollment periods, next day effective dates. And then beyond the underwriting questions you have to pass, I just want to point out a couple exclusions. Short-term medical does not cover pre-existing conditions. Meaning if you break your arm or tear your ACL or something, you can't sign up for a plan right after and get that covered. We're going to vet for pre-existing conditions to verify that it's a new condition after the policy started. So just keep that in mind. If someone's got a health condition going on that they still pass medical underwriting, that health condition still would not be covered as it was occurring prior to the policy starting. If you have any questions on that, just feel free to reach out. And then one other thing is these do not cover maternity or pregnancy. So if your client's planning on getting pregnant or currently pregnant, go with marketplace. Again, just not the right fit for short-term medical right now. For those of you who haven't seen this yet in our quoting platform, this is a very, very unique tool, and it's going to save you a lot of time and make your sales significantly easier. What this is a screenshot directly from our quoting platform, and I'll be doing a quoting demo at the end as well. So I'll show you how this works live. But essentially what this gives you the capability of doing is building out a marketplace package with the supplemental plans in there as well. And then you can make a second option in that proposal that builds out a short-term medical package with the ancillary. So you can compare side by side in a really nice, clean format what the pricing difference looks like, coverage difference looks like. As you can see, the marketplace plan on the left-hand side here, pretty solid Blue Cross Blue Shield of Nebraska plan. This is family of 4 35-year-old parents, age 7 and 4 dependents in Ashland, Nebraska. $6,500 deductible, runs about $1,500 a month. And then following suit with where I said short-term medical is about half the cost of a bronze plan, no subsidy. We're about right there. With the short-term medical, a $5,000 deductible, you're looking at $757 a month. The crazy part too about this package on the right with the short-term medical is, as you saw that little green box fly in, highlighting some fine print there. This is a 36-month rate lock, if you can read that. So plan on the left might take another 20% rate increase next year and the year after that, where this short-term medical package on the right, $836.76, is what you pay for the next 3 years. Your client doesn't have to worry about it, peace of mind. The savings are locked in, and not only that, they're going to get better and better in year 2 and year 3 as this plan continues to jump up there. So again, in this situation, you're saving your client over $9,000 per year, almost $10,000 there. And they have an even lower deductible, same ancillary suite where accident, sickness, deductibles covered, and cancer, heart attack, and stroke would give you a $25K benefit. A couple additional highlights, and then we'll dive into plan design, what's covered, how it works. So we talked about next day effective dates. Children only options is a very unique perk on these plans. So you don't have to have an adult or a parent on these plans with the kids. You can do child only plans. as long as they're at least 60 days old. This makes a lot of sense when you run into people who have group coverage or employer-sponsored coverage where they're on there. A lot of times those employers cover the premium for the employees or maybe the spouse, but the kids, the parents are paying full price for them to have them on their group plan with them. That's actually the situation I'm in. So Allstate does a great job covering my health insurance, but to add my 2 daughters onto my group plan, it was going to cost $600 a month, which I thought was absurd for 2 healthy little girls. So instead I put them on a short-term medical plan, and both of them combined costs $150 a month. So I'm saving over $5,000 a year by having my 2 girls on a short-term medical instead of my group plan with me. So it just opens up another opportunity for a new sales point. Deductibles also waived on urgent care is an important perk here. So almost everything else you have to hit your deductible first, but urgent care skips past the deductible. You just pay $50 access fee plus your co-insurance percentage. So if you're on the 0% co-insurance plan, you're just paying $50 for an urgent care visit. No socials are required as well. So if you run into non-citizens, asylum seekers, people who can't get other types of plans, you can put them on short-term medical. You just have to currently be living here. No citizenship info or socials are required. 3-year rate lock, talked about that. Nationwide PPO networks is really nice for people who travel frequently from state to state. This gives you a really nice PPO no matter what state you're in. And then short-term medical traditionally does not have a prescription coverage, but we do have this perk called Recuro you can add on to give yourself a $0 copay on those plans for most generic prescriptions. So we've got a lot of different plans in here, a lot of different plan designs, but I want to narrow it down, make it easy for you guys. 95% of our sales are the enhanced PPO plan, and that's the first plans that pop up in the quoting platform when you start a quote. And particularly the $5,000 deductible levels are the most competitive, that are going to give you the best value for your dollar, to give your clients coverage that goes a long way for what they're willing to spend. Within that 5K deductibles, you got 3 co-insurance percentage options, $1 million max for the coverage period. If your client's super budget conscious and is willing to sacrifice a little more coverage, you can go with the essentials. And if your client's pockets are lined and they really want to bump up that coverage period max and have a few copays, the copay enhanced could be the way to go. But most clients fit into this enhanced PPO plan bucket. I talked a little bit about Recuro, but this is essentially our prescription plan on the back end. So prescription coverage doesn't come with the short-term medical, but you can add on Recuro for $10 per month for the entire family is covered for $10 per month. And that gives you a $0 copay on about 95% of the top 800 most commonly prescribed medications. You also get unlimited no-cost telemedicine visits with this as well. You're usually on the phone with a doctor within 7 minutes. It's 365 days a year, unlimited uses, and no cost to your clients or their family members. We've got Aetna and Cigna, both options here for the short-term medical plans as well. Both are really strong nationwide PPO options. I would say it just depends on where your clients go to see their doctors, which networks those doctors are in, can determine whether you want to put your clients on Aetna and Cigna. Typically, if they don't have a preference, the Aetna network is better and cheaper, but definitely check them both out if your client has particular doctors in mind. As far as underwriting and claims go, so full list of underwriting questions is over here on the right-hand side of the screen. So just 4 questions. First one's pregnancy. Second one is current medical conditions that would knock you out. HIV AIDS is your third question, and then unresolved medical condition or recommended surgery or treatment that wasn't completed is going to be that 4th question. That's all it takes to pass underwriting and be eligible for the plan. And then anything that they are currently dealing with, any health conditions they deal with that aren't on this list, would be considered a pre-existing condition and excluded for the first year of the short-term medical policy. So just keep that in mind. Oftentimes people deal with health conditions and it's a $100 doctor visit a year, but if it's something where they're at risk for a bigger bill and it's likely, then again, go on marketplace. Even if they are eligible here, you don't want to put them at risk of having a big claim excluded. So let's dive into some supplemental now that we finished up with the short-term medical. But again, that was just a high-level overview. I know it is more complex than we can cover in 5 to 10 minutes. So if you have any other questions, feel free to reach out to Sherry or myself. Supplemental, like I was mentioning earlier in the call, it's going to be crucial for you to become cross-selling and supplemental experts if you are not already. The reason being is those max out of pockets keep going up and up and up. We're entering a world where catastrophic coverage is the main coverage, and you're going to have to find other supplemental solutions to cover your max out of pocket exposure. I'm a visual learner, so I like to use this one-legged stool example. It's also kind of goofy, so it probably wakes you up if I put you to sleep already. But this is essentially the situation your client is in if they're on a standalone health insurance plan. So one-legged stool, you'd have to be a heck of an athlete to stay up there forever. No one does, though. In reality, eventually everyone has a big claim. When they do on a one-legged stool, unfortunately, their wallet has to pay up to cover that deductible co-insurance, max out of pockets, they're big. It's important to ask your clients, can they pen the check when you're in the sales process? Hey, you're left with a $10,000 out of pocket exposure. Worst comes to worst, how much does that affect you? If that affects them significantly and they'd end up putting that $10,000 on credit cards or loans, definitely opens up the supplemental conversation. The average American only has $700 in their savings account, so quite the big discrepancy between $700 and $10,000. The answer here, of course, sell supplemental insurance, fill in those gaps. There's plans out there that are guaranteed issue, and in the event of any accident, will cover your entire deductible for you. There's plans out there like cancer, heart attack, and stroke. Again, will cover your whole deductible for you, or give you some extra cash on top of that to go on a vacation. So we'll be talking about a few of those. There's also plans like dental and life insurance that just aren't covered on a core health plan. So you can fill in the gaps that way. The important thing is to offer it, sell it, consult your clients, and be the expert. These go with everything, so you can sell them bundled with short-term, bundled with the marketplace, standalone. You can even list bill those for small groups. But the important thing is as well, when these plans are sold, we've actually found that acquisition costs improve, retention increases, and more referrals are generated. So it's a win-win situation for you and your clients. The reason being, I like to think, is you're just creating happy situations for your client, or these positive experiences, right? When your client, let's say hypothetically, tears their Achilles and goes to the hospital and they have to do surgery to repair it, and it's going to be very expensive, and they give you a call or shoot you a text and say, hey, in the hospital, tore my Achilles, I'm gonna have to get surgery. What's my out-of-pocket exposure? How much money am I gonna have to pay before my insurance kicks in? If you tell them the answer is $10,000 and then their insurance kicks in after that, that is gonna be a very disappointed client. Torn Achilles and 10,000 does not sound like a great day. But if you can tell them, hey, I took care of you, I made sure we got you the proper protection. You actually have an accident plan in place that's gonna cover your entire out-of-pocket exposure. You're not gonna pay anything out of pocket. That is a very excited, very happy client, despite laying there with a torn Achilles. So just creating those positive situations gives you clients for life. Those clients want to refer you to their friends and family. And that's how those referrals are generated, and their retention is going to be increased. First plan I want to talk about here, and it goes along with that Achilles example, is Plan Enhancer Accident Plan. So if you haven't sold this before, turn up the speaker a little more so you can hear me out here, because this is our hottest seller on the supplemental side. The nice part, it's guaranteed issue, so you can sell this with marketplace plans really easy as well. This is an accident plan at its core, has a wide range of benefits between $2,500 and $17,500. The strategy you want to follow here is figure out what their deductible or max out-of-pocket exposure is and match that to the benefit level. That way, when they get in an accident, this plan essentially covers their deductible for them. And then after that, their core health plan, the short-term medical, or the marketplace, or the group plan can kick in after that and cover the rest. That's also available for seniors up to age 75. So if you have Medicare clients who are between 65 and 75, you can sell them this accident plan as well. For the under 65 clients, there's 2 optional riders as well. So the first one being a cancer, heart attack, and stroke rider, and then the second one being a sickness hospitalization rider. How these work is they pay out a lump sum, first ever diagnosis on cancer, heart attack, and stroke, and they pay a lump sum if you're admitted to the hospital due to sickness. The nice part is that encompasses about 90% of claims when you can cover accidents, cancer, heart, stroke, and sickness. Most situations at that point, your client's deductible is being taken care of for them, and they don't have to worry about that max out-of-pocket exposure anymore, giving them a lot of peace of mind. Next plan I want to talk about is our cancer, heart attack, and stroke. So this one also pays a lump sum cash benefit, but instead of being a rider on that plan enhancer, it's just a standalone product, or you can sell it bundled, of course, with a core health plan. Guaranteed issue levels at 25K and 30K. So again, really easy sell there. Guaranteed issue does not mean guaranteed coverage. I wanted to put that disclaimer out there. This pays for first ever diagnosis. So if you've had cancer before, or you currently have cancer, you can't sign up for the plan and instantly get a $25,000 check. But if you've never had cancer, heart attack, or stroke before, guaranteed issue, come on in. And if you get that diagnosis, unfortunately, you can put that money towards your deductible, vacation, paying off debt, whatever you need to do with that. It's your choice. Also, with the cancer, heart attack, and stroke plan, recently we rolled out a cancer-only plan in most states, and that's also available for seniors. So if you're interested in just the cancer benefits without the heart attack and stroke, definitely look at our cancer-only plan. As far as dental goes, I know there's a lot of dental options out there, and Allstate isn't known as being the creme de la creme in the dental carrier space, but I do want to challenge that a little bit. I hear from a lot of experienced agents that this copay 2 dental plan is the best dental plan in the dental insurance industry. And let me tell you why. So first off, most dental plans have annual maximums. Once you hit that maximum, you run out of coverage. Those annual maximums are typically 1, 2, maybe if you're lucky, they go to $3,000 or $4,000 for that maximum. This copay 2 dental has no annual maximum, so you can't run out of coverage. The crazy part about it as well is plans that have big annual maximums or no annual maximums have big waiting periods, or they cover a really low percentage year 1. The copay plan 2 has no waiting periods as well. So no waiting period, no annual max means you could essentially sign your client up for a plan starting tomorrow, and they could go get a root canal taken care of tomorrow and just pay a copay of $500. We're going to take care of the rest of the cost of that root canal. $0 copay on preventative. Basic service is covering things like fillings. Major service covers things like wisdom tooth extractions. Copays get even better in year 2 as well. So no annual max, no waiting period. This is an incredible product, and it's very affordable as well. In most states, you're looking at $45 to $50 a month per person. The only thing I want to have you watch out for is there is a bundle requirement. So this doesn't have to be $100 or $200 a month plan you bundle it with. You can bundle this with a $10 a month accident or a $10 a month cancer plan. It just has to be sold with at least one other plan. The other dental plans we have are more traditional. It's the Value Plus and Prime. Prime is by far the hottest seller in here, and the one I'd recommend. The reason being is this is a solid family plan or child-only plan, as it covers orthodontia benefits as well. So you'll see it's our only plan with the orthodontia or braces coverage. That orthodontia benefit is only for 18 years old and younger, so it is an adolescent style plan for those orthodontia, but adults would get all the basic services, major services, preventative, but very solid family plan. If you have kids needing braces, go Prime. If you don't have kids, or you're lower utilization, or they don't need braces, I'd probably recommend Plus. So because you guys joined this webinar this morning, you get a sneak peek at our brand new product we are about to launch in a couple months. This is going to be our hottest seller in 2026, and it's not even going to be close. The reason being is with short-term medical, it's a very solid plan. It's about half the cost of a bronze plan, but you don't get the preventative perks and the labs up front paid for like a marketplace plan. That's going to change when this product launches because we're essentially going to combine a fixed benefit plan that covers the preventative, the labs, the radiology, ambulance, surgery, hospital admission, all that upfront little stuff is taken care of by a fixed benefit plan. And then it's paired with and combined with a high deductible short-term medical plan with $5 million of coverage on the back end. This essentially means your client has the perks of day one benefits before having to hit a deductible, combined with the protection of catastrophic coverage on the short-term medical side. This is going to be a huge product, and it's going to be priced really well, around the same as our $5,000 deductible short-term medical plan. This is set to launch May 1st, effective dates quoting April 29th in this initial list of states. As soon as Texas and North Carolina go back to 3-year plans, they'll be in that list as well. But Missouri is in there. I know a lot of you are there. Wave 2, we're also going to get Iowa, Indiana, I know are a few big ones for you guys. So this will be by open enrollment, all this second wave of states as well. The nice part about these plans is it's going to use the Aetna network. It's going to have one ID card for simplified claims processing. It's just one application, one set of underwriting questions. It's not like you're packaging two together. It's already packaged on our end in the back end. So it'll be really easy for you and your clients. Another thing I wanted to mention is our incentive trip. So this is reserved for the top 50 agents across the country with Allstate. This is a really, really amazing trip. 5-star, all-inclusive, bring the plus one. We pay for airfare, food, drinks, golf, all of it. If you can sell about $600,000 this year, that would put you in a really strong place in the running. If you think you are one of those individuals who can throw up $600,000 this year, please reach out to me. Let's put together a strategy and a plan of how to get you there, and so I can be aware and support you guys the best as possible. But would love to see a couple of you guys there so we can toast margaritas on the beach, wherever it ends up being. Couple highlights, and then we'll dive into the quoting platform. But that ACA alternative short-term medical, you can rate lock 3-year plans. This should be your bread and butter all year. Of marketplace enrollees have premium exhaustion. They lapse off those plans over the next couple months because they sign up for a no subsidy plan hoping for an extension. Short-term medical should be the first thing you look at. If new clients come your way looking for affordable solutions, short-term medical should be the solution. So just keep that in mind. We've got our incentive trip, children only options, makes us flexible, no social required. Comparison tool, which I'm about to show you now, which is going to be a really nice tool to help sell your clients. And then copay 2 dental, no waiting period, no annual max, best dental plan in the industry. And then guaranteed issue accident and critical illness plans, like we covered, they're going to be crucial for you to become an expert on this year. One last pitch on why Allstate, and then we'll dive into this quoting platform. But one thing I do not want you to lack, and one thing you will not lack here at Allstate Health Solutions, is a white glove red carpet experience. We strive to provide you guys support, training, answer your phone calls the first time. You have one-on-one support here. You can call myself, you can call Sherry directly, which is really unique for a carrier where you don't have to wait on hold for 30, 40 minutes to get the runaround on something. You can go directly to the source. Not only that, your clients as well. All of our member services agents are based in the USA. Most of them are in Milwaukee. So again, you don't have to wait for 40 minutes on the phone as the client and then get the runaround. You can go directly to the source that way. We're innovative. We're the first one back with short-term medical when the regulation changed. And more important, I think, than anything, as we speak agent, I started as an agent. I've been in your shoes. I love the insurance industry, but what I love most is being able to help agents grow their book, be strategic about this, and really make more money and better protect their clients. I know you guys have the most stressful job in the industry, so if there's anything I can do to take a little bit off your plate, please let me know. I'm happy to do it. So let's dive into the quoting platform, do that demo. I'm going to throw my contact info up on the screen one more time as I get that set up. Should take me about 20 seconds. All right, so let's dive in here. I've got a Lease Summit zip code plugged in, Missouri. I'm gonna go with a female, and we'll keep it nice and clean, 40-year-old. And then we can do as soon as next day effective date. So that's what we're gonna do. I'm gonna plug a family in here as well. So I'll go with spouse and dependent, hit quote now. And some of you may be wondering what are prices like? How can I see prices? I would say just get into the quoting platform. All it takes is zip code, date of birth, gender, effective date, make them up if you have to. And just play around with the system, get comfortable with it, and you'll see prices right off the bat as well. Gonna keep dad, 40-year-old as well, and then we'll go 7-year-old boy. And 4-year-old girl. Hit quote now, and then you are in here seeing all the different products. So on the left-hand side of the screen, you're going to see all the different product categories, short-term medicals right there at the top. Health on exchange, this is how you're going to start with the marketplace plan option. So within the health on exchange, it's going to ask you to acknowledge consumer consent statement, nicotine question, household size and income to check if they would be eligible for a subsidy and how much subsidy they would get. So that's a nice little fast tool you can use. We'll hit show plans here. It'll load for a couple seconds and then we're in. From here, I can filter. So if I want to compare silver or gold, I can. I'm going to go with bronze and catastrophic for this example. And as you can see, it said $0 subsidy at that 130 grand level for a family of 4. Ambetter's looking at about 1,400. You're looking at about the same for an Oscar. Blue Cross Blue Shield, a little more, but not too bad. Let's go with this Blue Cross Blue Shield plan. This first one, $8,000. Deductible, $1,500 a month. From here, I can package in the supplemental. So I'll throw in the dental prime since they have kids in case they need orthodontic coverage. And then I'm going to go to accident tab. And since they have an $8,000 deductible, I'm going to pick an $8,000 plan enhancer. That way it knocks out their deductible for them. Perfect. So now we're covered for accidents, dental, and then we've got the Blue Cross. To start the 2-option proposal and put this side by side with the short-term medical plan, all you have to do is hit this email proposal button underneath where it says apply. I hit email proposal. It's going to load for 5 seconds or so. And then from here, you could send this off to your client, but we're not quite ready. So I'm going to scroll to the bottom of the page, hit add another package. And this time I'm going to go with the short-term medical so we can compare the pricing and coverage side by side. For short-term medical, it's going to ask you slightly different questions. First one is nicotine. We already answered that. The second one is, have you had insurance 9 of the last 12 months? This is not an eligibility question. That's just a preferred rate question. And that's any type of insurance 9 of the last 12 months. Height and weights, I'm going to plug in 5'10", 180 on both of them. Keep it nice and simple. And just so you know, 250 pounds is the max weight for females. 300 pounds is the max weight for males to be eligible. You can ask me the rewrite question. I'm going to hit no, as this will be a new cell. And then because our weight is under preferred rate and we answered this yes, it'll say, do you want to see preferred rates? Show me questions. Always hit that button, because if you can answer no on these 3, motorcycle, DUIs and speeding tickets, high blood pressure, high cholesterol, anxiety, depression, you answer no on all that, you're getting a 20% rate discount on your rate. Hit view preferred rates. Once I'm in here, you're going to see a couple options to stick to the monthly. That's going to be the simplest for you. Hit this drop down and you're going to see a couple options, 36-month plan and then 36-month rate lock. The 36-month without the rate lock is cheaper year 1. So you can see it's about $2,000 for that most expensive plan. If I go rate lock, it jumps up about 20% to $2,400. But just know, on the rate lock, your client doesn't have to worry about a price increase for the next 3 years. I think it's well worth it, especially with how competitive these plans are. Let's scroll down here and we'll go with the Aetna plans. As you can see there, depending on the state, so Cigna, $5,000 deductibles, $2,000. If I go Aetna, we're half the cost. So Aetna is the way to go in Missouri there. 36-month rate lock again. Most popular plans are the enhanced PPO with the $1 million of coverage, first ones that are popping up here. And from here, $5,000 deductible levels are typically the most competitive. I like the $5,000 80/20. This feels like the sweet spot for me. For pricing, we'll throw this in the cart, $853. Again, that's rate locked, so client doesn't have to worry about the price jumping up for 3 years. It's going to pop up the Recuro. This is the prescription and telemedicine for $995 a month for this family of 4. I am going to leave that on. I think it's a good perk, especially for people utilizing that. But take off the behavioral health. If you wanted virtual counseling or therapy, that is an option. Perfect. From here, I am going to now go and add that same dental plan we did with the marketplace. So I'm going to stick with this prime plan, $158 a month for the family of 4. Again, that's the plan that covers the orthodontia. If there weren't kids on the policy or this was going to be high utilization and they needed the no waiting period, no annual max, that's the copay plan too. Another thing to note, there's no bundle requirement on the prime plan, but it does get a 15% bundle discount if you pair it with anything else with us. So I'm going to go to the accident tab now, and we have a $5,000 deductible. So this time I'm going to go with the $5,000 plan enhancer accident plan, add that to the cart, and now we are set. So I'm going to add this to the proposal, and then it's going to think a little longer since we have 2 options in here this time, probably about 10 seconds total. And then once we're in here, you're going to see the side-by-side of the marketplace package to the short-term medical package. You can edit these titles as well. If you want, you can just put whatever you want in here. I'm just going to put marketplace short-term medical. As you can see, this saves the family of 4 about $700 a month. It's $8,400 per year. I know people jump through a lot of hoops, go through a lot of stressful and has to refinance their houses and save a lot less money than that per year. So this is a really big value for your clients to save $8,400 per year. And again, those savings are just going to get better and better because we've got this 36-month rate lock. This plan could go up to $2,000 next year and $2,300 the year after that. But this is essentially all I've got for you guys today. From here, you can send it off to your client. You can just take a screenshot, text it over to them, whatever you guys want. But it should help you guys quite a bit. I'm going to throw my contact info up here one more time before we close it out. I want to thank you guys for joining today. I hope it was useful. Again, if you need anything, if you have any question, if you have any quoting scenario, you just want to chat about the market, whatever it may be, give us a call, shoot us an email. We are here to help you guys out. That is our jobs. So there are no stupid questions. Feel free to reach out anytime. Thanks again, Sadie, for setting this up as well. You guys do great, and we really appreciate your partnership.
Awesome. Thank you so much. There's so much info there. I took plenty of notes, but we are going to enter a time of questions here. We only have one question in the chat. It's a little quiet, so please throw your questions in there. We'll be here for just a few more minutes. Excuse me. We do have one question here, Caden, and then I have a couple questions of my own. For the plan enhancer, can it be used in coordination with an high deductible plan, HSA plans, individual and group? So what can it be used in coordination with?
Yeah, so the nice part is you can sell that standalone or with any type of other policy. It also does not coordinate benefits, which is a huge perk of it. So let's say, for example, you've already met your deductible for the year on your marketplace plan. So your out-of-pocket exposure is 0 to begin with, and then you get in a $10,000 accident. The plan enhancer, if you have a $10,000 plan enhancer, is still paying out that 10 grand. It would just go back to the client. So not coordinating benefits is huge. Sell it standalone, sell it bundled with any other product. It doesn't matter.
Awesome. While we wait for a couple more questions, I have a couple of questions of my own for you, Caden, here. One, at Senior Marketing Specialist, we love talking about cancer insurance. We're really passionate about cancer insurance. So it was cool to hear about your guys' plan. I know that there's no look back period for what you guys have. It's just first diagnosis, but I didn't know if there was a reoccurrence benefit at all on there, because I know that's something that sometimes people look for. So if you've been on the plan, were diagnosed with cancer, and then have a clean bill of health, and then maybe like in 5 years or something, if there's a reoccurrence benefit on that.
Yeah, great question. It is just the one time. So first ever diagnosis is going to be the only time we would pay out that benefit. If you're on like our cancer, heart attack, and stroke plan, though, and you get the cancer benefit, you can keep that plan. And if you happen to have a heart attack or stroke, that would still pay out as well.
Awesome. Okay, good to know. And then I was wondering, so this copay 2 dental plan was pretty cool to hear about. And I know that dental plans used to kind of just be tied to Medicare supplements. Speaking from a lot of our agents, most of our agents are people who are selling for 65 and above. So that plan was intriguing to me, but a lot of Medicare Advantage. It used to be tied to just Medicare supplements, but I know in the last couple of years, dental plans with all the changes in the Medicare Advantage market have kind of gone down. So even people with Medicare Advantage plans have been looking at options for dental coverage. So this was interesting to me because seniors are still able to get on it for that first 10 years. I was wondering what the availability looks like for that plan, primarily if it's available in Missouri, because that's where most of our agents are at, or probably on. The agents that are on right now, that's where they're probably from.
Yeah, the copay plan 2 is available in Missouri. It just recently launched there, so it's only been live in Missouri for about a month. So yeah, that's probably why you haven't seen it before. But yeah, so copay 2 plan 2, super solid, available in Missouri now. So if you haven't checked it out yet, definitely check it out or reach out with any questions.
Awesome, that's great to know. It doesn't look like we have any more questions coming in, so we'll go ahead and wrap this up. But you guys, if you have any lingering questions, of course, you can reach out to us, reply to that follow-up email, and then write down Caden's information here too. We want to make sure that you guys are connecting with your reps and connecting with the people directly at the carriers, as well as us. But please feel free to reach out to us, reach out to Caden if you have any follow-up questions. We'd love to help you out. But until then, it looks like, let's see, has this been recorded? Yes, this was recorded. You'll receive it in your follow-up email. So if you missed part of it, no worries. But it doesn't look like we have any more questions. So Caden, thank you so much. You brought so much information to us today. Thanks for taking the time to talk through a lot of it with us. And if you guys have any follow-up questions, you want to deep dive on the things that you talked about, please reach out to Caden. But do you have anything left before we get out of here?
No, that's it. Appreciate you, Sadie, setting this up and bringing questions to the table as well.
Awesome. Okay, guys, we'll get you back to your day. Thank you.
Thanks. Bye.